I started talking about my daughter's asthma, and her advice was, why don't you bring your daughter to Parker Wellness Clinic, and we will be able to treat her asthma. Chiropractor treating asthma, I don't know about that, but I thought like there is hey, before I came here, I had no clue what was chiropractic and what magic chiropractic is, right? So I thought like there is no harm in taking her to the clinic, and somebody can look at her and tell me like what we can do. So of course like I brought her here. She examined her and she did thorough neurological examination on her, and she was telling me that she's subluxated in thoracics, and we need to adjust her thoracics. Okay. And then of course the staff doctor was also there. Okay. And I started bringing her here. She recommended me that twice a week I should bring her here. So I started bringing her here twice a week. Okay. And in the meantime, of course, like I applied to Parker, and I got a job here in Parker, and of course I joined Parker. All right, so 6 months, every 2 weeks, I was bringing her here. Okay? And after 6 months, her staff doctor comes to me, and she was still on preventive medication. Right? And she would get her asthma attacks here and there. Okay? So he asked me to stop this preventive medication, and I was kind of, oh, I don't know, I want to do that, but he said, trust me, stop that, and we will adjust her frequently and see how her body is responding. And of course, he did tell me that children, they respond, their response is really good, and she is developing. So maybe her kind of like a spinal curvature that will also change. On top of it, we will do her adjustments. That will make some improvement in her asthma attacks. And yes, I stopped her preventive medicine, and I said, okay, let's see how that goes. And for about a year, we were under chiropractic care. Okay. Then started the next year, and what I started noticing that every other month she was getting her asthma attack. Now it's every 2 to 3 months. And then as the time went by, it was kind of like, 5 months. In fact, I started plotting a graph to see that, how far they are. Of course, like, we are science, we are scientists, so, we have to have evidence, right? Like, okay, they were every other month, now it is 2 to 3 months, and then later it was a year went by when she did not have any asthma attack. And I'm like, oh my gosh, what is this here? And then, of course, I threw away all my steroids and Ventolin and everything, and she started feeling lot better and better and better. Okay? And so now, she does not have asthma. It got lot better. And her case was presented in, so many conferences, and the staff doctor, he wrote the whole report on her, and with all the evidence and everything. So the medical doctor started believing in chiropractic, and then my son, he came up with scoliosis. He was diagnosed one day that yes, on his physical checkup that he has scoliosis. It was about, I think it was 9 degrees. Okay. And then my thing was, okay, we are not doing surgery on him. And I took him to a lot of other hospitals too. And then, of course, I brought him here. And these people, they were so confident, yes, we can take care of this scoliosis. Yes, we will need regular adjustments. And it got a lot better. It was 9 degrees, 7 days, every single time, after 6 months, we will reassess and then, do we see any improvement? Okay, and how to kind of, measure that and go, lot, of course. Lot better. So, my two experiences here. And then, of course, there were so many other experiences. Then what happened that my entire family started coming in here. I recommended all my friends. I have a friend who has autoimmune disease. She's on immunosuppressant, very miserable. And then, I asked her like if she wants to go and see a chiropractor. And then, of course, I gave her the contact. so much happy that she is under chiropractic care. Um, it is subjective, like there is improvement in her signs and symptoms. Though she is on, of course, immunosuppressant drugs, but at the same time, quality of life is better for her now as it was before. So then, in fact, I started researching into that, like, chiropractic adjustments and their effect on immune system. Okay. I did a literature review, and yes, I still need to tweak that paper a little bit so that I can publish. But definitely, there is some association, and we did look at that, right? In the beginning, I showed you a slide where it was saying that as nervous system, if there is any problem in our nervous system, signals to our other organs, those are impaired. Then, if the signal is impaired, function will be impaired too. Right? So, nervous system, alignment of nervous system, proper functioning of nervous system, it is immense important. I will stop this here. Okay, we will continue on Monday. Okay, and yeah.